All right, Jamie, is the correct screen showing the PowerPoint?
Yes.
Awesome. Well, welcome everyone. Thank you for being here. We'll get started in a couple moments. We're just going to let folks join and in, and then we'll kick off the meeting. And if you have a moment, please fill out our demographic survey. We have the link in the chat and also a QR code on the screen. This is just a way for us to know who's in the room. It is voluntary, so please only answer the questions that you feel comfortable with, but we would really appreciate everyone participating. Thank you. Good morning, everyone. For anyone who just joined, welcome. We are just waiting maybe another minute or so to let folks join. But we're really happy that you're here. If you have a moment, please fill out our demographic survey. It's in the chat. I think we'll pop it in there one more time. Perfect. Thank you, Jamie. And then we also have the QR code on the screen if you have a mobile device. This is just a great way for us to know who's in the room. It's voluntary, of course, but we would really appreciate everyone participating. Thank you. All right, how is the waiting room? Do we still have some folks trickling in?
Here and there, yes.
Okay.
It's slowing down a little bit.
All right, I think we'll probably get started soon. I'll do one more plug for anyone who just joined. If you have a moment, please complete the demographic survey. We have a link in the chat and also a QR code on the screen if you have a mobile device. This is just a great way for us to know who's in the room. It is voluntary, so it is optional to do it, but we do highly encourage everyone participating. Also, I think when we started the recording, everyone's cameras, they were turned off. So we would love to see your faces only if you're comfortable, but if you would prefer, please feel free to stay off camera. But I would love to see folks, especially at the centers, if that's possible. Awesome. Hey, Mary, Jermaine. Oh, I see. Hey, Carrie. Hi, everyone. This is awesome. Okay. All right, let me open up my chat so I could stay informed on what folks are saying. Okay. I think we'll dive in. I think we have a good number of folks. All right, so welcome to Lake County's LCBHS Behavioral Health Services Act Community Planning Meeting number 1 for the fiscal year 26-29 integrated plan. Really excited to have you all here today. This is a big meeting. This is our first BHSA meeting, and so we have a lot of information to share with you all, and we have a lot that we want to learn from you. So first, to kick us off, I'm actually going to pass it over to Scott for a welcome, just to welcome everyone in and some opening remarks. So Scott, please.
You bet. Thanks, Paulina. My name is Scott Abbott. Work for Lake County Behavioral Health Services as the program manager for the Behavioral Health Services Act and Housing. If you've participated with us before, you probably have a little idea of what we're doing today. This is a community meeting for now what used to be the Mental Health Services Act, now the Behavioral Health Services Act. And this is our first foray into BHSA from MHSA. Today we want to talk about a little bit about the differences between the two. I think the main goal that we're trying to really achieve today is as we go through this transformation, the community needs to be involved in that transformation. We have always depended on community feedback and guidance in what we do as far as MHSA, and that will continue with BHSA. And so this is we're starting to kick off a little early this time because of some new requirements for BHSA, but a lot of it will be the same. But this one, we really want to talk about what are the differences and just kind of, set the foundation so we can, in future meetings, we can really dive into it. But this is kind of the overview introduction. But one thing I do want to say, as I always say, is I super appreciate you being here. Like I said, we depend on the community for their feedback. We know that you have busy schedules and have other things that you have to do. So it's just super appreciated that you took the time to be here, because this is important not only for our department, but for our community and for the people that we serve. And so thank you for being here. And now we'll turn it back over to RDA, Paulina and Jamie, who are our consultants in this process.
Thank you, Scott. Yes, again, welcome everyone. I think Scott said it really well, but we're actually going to start with just going over why are we here today. So as Scott mentioned, today is the first community program planning meeting for Lake County Behavioral Health Services, Behavioral Health Services Act, BHSA 3-year integrated plan. The Behavioral Health Services Act replaces the Mental Health Services Act, or MHSA, which was previously used to fund behavioral health programs in Lake County and is still funding programs right now. Under BHSA, Lake County will be updating how they plan, invest, and deliver services. And today is one of many opportunities for the community to come together to learn about BHSA and provide input. Your input is key to informing the integrated plan for the next 3 years. So really our objectives for today are to first provide an overview of BHSA, to have everyone have a shared understanding of the changes and the differences between BHSA and MHSA. We're also going to review the CPP, or Community Planning Process Activity Timeline, and all the ways that the community can get involved over the next few months. And we'll also introduce LCBHS's BHSA proposed funding shifts and gather your input. Oh, I'm so sorry. I see in the chat, Julia is unable to hear me. Can everyone else hear me okay?
Yes.
Okay. Julia, I would check your audio. I think if you go up to the mic icon at the top, you can select your audio, whether it's headphones or your speaker. So sorry. If you have any specific questions, one of my team members can help in the chat as well. All right, to kick us off, we're going to do something new. This is a new platform. It's called Mentimeter, and it's a way for us to gather information from you all through a poll. So this is very new. We used to do Teams or Zoom polls, but we thought it'd be fun to make it interactive and everyone can see the results as they come in. So to participate, please head to the link that's going to be dropped in the chat, or feel free to scan the QR code in the bottom left of the screen. We'd love to know, have you been to a previous Lake County MHSA community meeting before? Yes, no, maybe you're unsure. We'd love to hear from you. So it looks like we have 4 folks that have been before. Allison in the chat, yes. Dalen, yes. We have 1 new person. That is so exciting. Welcome. 5 yeses. And as a reminder, my colleague Jamie did put the link in the chat for everyone to navigate to the poll. 6 yes. I'll keep it up for maybe a couple more seconds. Looks like we have a lot of returning folks, which is really exciting. And we also have new folks too. Awesome. All right, another awesome welcome. We have another new person. This is really exciting. Awesome. All right. Well, I'm glad that this worked. We weren't sure if Mentimeter was going to work, but thank you all for participating. This is great. So it looks like we have a mix of folks that are returning and folks that are new to our community meeting. So welcome, everyone. We're really excited that you're all here. All right, so we've done our welcome, but we haven't yet really done introductions. So unfortunately, since we have so many folks joining today, it's really difficult to do individual introductions in the time that we have. But we ask that folks put their name, their pronouns, and their program in the chat. I know some people have already started doing that. I'm seeing Henry, Melissa, Julia. So feel free to introduce yourself in the chat. We'd love to know who's here. Oh, it looks like we have participant. Perfect. All right. So I also want to acknowledge that this is a hybrid meeting. As Scott was saying earlier, we have the peer support centers here. They have so graciously opened up their space to host this meeting in person. We'd love to just hear from them. If the peer support centers are able, feel free to come off of mute. We'd love to hear how many people are in the room and just make sure that we have all the peer support centers here with us. So does any peer support center want to start? Feel free to come off mute.
Hi, this is Lavos Peer Support Center, and we have 3, 6, 9. We have 12 people here today.
Awesome. Thank you all. Welcome.
So Kim has her hand up.
Oh, Kim.
Hi, we're navigating some internet challenges, technology challenges, but we are at the Harbor on Main Youth Resource Center. There are currently 5 of us present and anticipating more.
Awesome. Thank you so much. I'm sorry about the technological challenges. Please let us know if we can help in any way.
Thank you.
Anyone
It's user
else?
error.
Oh, well, thank you for working through that. Oh, go ahead, Carrie.
Hi, this is Carrie from the Circle of Native Mayans, and we've got 4 people in here, and then Melanie is watching from her office.
Awesome. Thank you so much. Thank you all for being there. All right. Do we have another center in attendance? Do we have Big Oak?
They were here.
I think they were. I feel like I remember
I-
seeing them, but
I still see them in the attendee list. Maybe they're having trouble unmuting.
oh, that is okay. Well, if Big Oak is here, feel free to put in the chat how many folks are with you, and we'd love to say hello. All right, so I see Allison's chat or message in the chat, and that was just where we were going to go. So wanted to introduce myself. So my name is Paulina Hatfield, and I'm a consultant with RDA Consulting. My colleague Jamie Dorsey, as well as my other colleague Julia Owens, who will be here very shortly, who are also in attendance. We're working with Lake County Behavioral Health on their BHSA integrated plan for fiscal years 26 through 29. We've been working with Lake County Behavioral Health for the past few years, including last year's annual update and the past 3-year plan. So hello, we're very honored to be here, and it has been a joy to work with Lake County Behavioral Health over the past few years. Awesome. All right, so we're going to give a brief overview of what we're going to be doing today, a brief agenda. So first, we're going to start with a Behavioral Health Services Act, or BHSA, overview. So we're going to go over what Prop 1 is. We're going to describe the funding and reporting changes. We're going to introduce the behavioral health goals. And we're also going to go over our community planning process, activity timeline, and all of the things that we have planned over the next few months. And then we're going to end that with a Q&A for anyone to ask any questions about BHSA, the community planning process, or anything on their mind. The second half of the meeting is going to be dedicated to Lake County BHSA proposed funding shifts and updates. So we have many updates to share with you all since our last meeting together. I think it was in June. And so we're going to talk about the small county exemption. We're going to talk through housing interventions, which is a new funding category under BHSA. We're going to talk through some proposed funding shifts, and we're going to end that time with a poll and a discussion. So a group discussion around the funding shifts, how folks are feeling, and get your input. And then we're going to end with next steps. I do want to say that although we're entering into BHSA, this meeting today is very similar to the community meetings that we've had in the past. So the next few slides should be very familiar to you all. So we're going to start with some quick tips on how to fully engage in today's meeting, with this being a hybrid meeting. So for those in person, there will be a coordinator on site to manage the meeting. For those joining virtually, it's always best to find a quiet, distraction-free location with a really strong internet connection. However, I know that that's not always possible, and that is okay. I know, as you all know, I've also had my own Wi-Fi and internet issues during these meetings as well, so we all have grace. But just let us know if we can assist in any way. Jamie or myself or our colleague Julia, who will be joining later, can assist via chat to the best of our abilities. We also ask that you save any substantial comments for our Q&A portions. We're going to have 2 of those today. But of course, please feel free to put any clarifying questions in the chat, or feel free to raise your hand. And if you're in person and have a question, feel free to physically raise your hand, and your on-site coordinator will let us know that there's a question. Lastly, just some other housekeeping items. For those online, you can raise your hand by selecting the raise icon at the top of your screen. And then you press the mic icon to the right when you're ready to speak. If you're calling in via phone, you can raise your hand by pressing *5, and then you can unmute by pressing *6. Also, for those online, you can always use the chat whenever you have a question or anything that you would like to bring up. So feel free to click the chat icon at the top of your screen. If you have any comments and then you don't really want to share them in the chat or out loud, please feel free to send them to Scott Abbott via email, and his email is on the screen. All right.
I also just want to real quick just introduce Patricia Russell, who's our MHSA analyst, and she's the one that sends out the emails, and she's also helping monitor this meeting to make sure it technologically flows well.
Absolutely. This would not have been possible without Patty. So thank you, Patty, for everything that you do.
Of course.
All right. So we're going to jump into a time of training and education around BHSA. If you've been to our meetings last year, we did start doing some education on BHSA. This year, we're really expanding it and focusing on BHSA. All right. But of course, before we can even talk about BHSA, we have to first go over what MHSA is, or the Mental Health Services Act. So MHSA was originally Proposition 63, which was passed on November 2nd, 2004. It is a 1% tax on income over $1 million to expand and transform mental health services. And this is commonly termed the millionaire's tax. MHSA was the predominant funding source for many counties. And MHSA funds Lake County Behavioral Health Services and mental health programs under 5 component areas, which is to the right. These are probably very familiar to you all. So the 5 categories are community services and supports, CSS, prevention and early intervention, PEI, innovation, capital facilities and technological needs, and then workforce education and training. And we're going over those because those funding categories have shifted now that we're transitioning to BHSA, which we'll talk about very soon. So as I just mentioned, MHSA is being transformed into the Behavioral Health Services Act as part of Proposition 1, and that is to be fully implemented by July 1st, 2026. As a reminder, and to bring all of that information back to the local level, here are the MHSA programs in Lake County that are currently funded through fiscal year 25-26. So you'll see in the dark green or the darker green are those 5 funding categories. And then underneath all of those are programs within Lake County that are currently being funded by MHSA. So you'll see the peer support centers, you'll see Native American peer counseling, mental health first aid, prevention mini grants. There was an innovation project that's currently being funded. So we just wanted to bring this back to the local level because I know a lot of that information doesn't seem pertinent, but then we bring it back to what programs are currently being funded. All right. So moving into Proposition 1. So Proposition 1 is an initiative proposed by Governor Newsom to modify the behavioral health system, emphasizing the expansion of housing and treatment options for those with serious mental illness. This proposition was passed in March of 2024, and there are multiple key priorities. Firstly, BHSA has a focus on the most vulnerable individuals living with serious mental illness and/or substance use disorders, and are at risk of homelessness, are unhoused, and/or justice involved. BHSA is also focused on increasing access to permanent supportive housing and residential treatment, also increasing access to substance use disorder treatment and co-occurring services. And lastly, BHSA is really aiming to create transparency in behavioral health planning, expenditures, and client outcomes. So just by these priorities, you can see that there are a lot of differences between BHSA and MHSA. With MHSA being mainly focused on mental health, and now we're moving into substance use and integrating that as well as housing. And as a reminder, full implementation of BHSA is expected by July 1st, 2026, but Lake County was really ahead of the curve and started planning in 2025. So Prop 1 has 2 components. Firstly, there's a Behavioral Health Infrastructure Bond Act that authorizes about $6 billion to build or develop behavioral health housing and treatment. And this is across the state. And then what we're talking about today is the Behavioral Health Services Act. That is the second component of Prop 1. And that's what amends the Mental Health Services Act. So some of those key changes include renaming MHSA to BHSA, expands funded services to include substance use treatment, which I mentioned a little bit earlier. It revises the distribution of MHSA funding to prioritize housing. So as I said, those 5 funding categories under MHSA are now being slightly modified. BHSA emphasizes full service partnerships and evidence-based practices. BHSA shifts funding for prevention from the local level to the state level. It mandates an integrated plan for department-wide behavioral health services. So we're not just reporting on programs that are funded by BHSA. This is also reporting all the programs within a mental health or within a behavioral health division. Also, BHSA establishes statewide population behavioral health goals to inform county planning and resource allocation, and we're going to talk about those very soon. And also, BHSA requires collaboration and input from a much broader group of community partners. All right. So as I mentioned before, the switch to BHSA revises the distribution of MHSA funding to prioritize housing. However, I do want to emphasize that this is still a 1% tax on those that make more than $1 million. So the funding is relatively staying the same. It's shifting a little bit where some is going to the state, but I just wanted to make sure that that is known. So this changes the original 5 funding categories under MHSA to 3. So the money is staying relatively the same, but the categories of funding have shifted, or how it's distributed has changed. And so changing from the original 5 categories to 3. So this includes full service partnerships, behavioral health services and supports, and housing. So full service partnership services include comprehensive and intensive care for people at any age with the most complex needs. An FSP, or full service partnership, is also known as the whatever it takes model. Behavioral health services and supports includes early intervention, outreach and engagement, workforce education and training, capital facilities and technological needs, and innovation, pilots, and projects. So if you remember that capital facilities and technological needs, innovation, those were originally their own funding categories, and now those are within behavioral health services and supports. And then lastly, housing. This is a new funding category. This includes behavioral health housing interventions that increase access to permanent supportive housing for people meeting BHSA eligibility who are chronically homeless, experiencing homelessness, and or are at risk of homelessness. And as I said before, counties can include innovation projects across all of the BHSS categories. So those are not gone. All right. I'm just checking the chat. Yes, we will definitely send out these slides and they'll be posted after this meeting as well as the recording. I know this is so much information to take in at one time. So now what is the BHSA integrated plan? So in addition to all of those funding changes, there's also reporting changes. And under BHSA, all counties must develop and submit an integrated plan. It serves a very similar purpose as the previous MHSA 3-year plans, but there are many differences. So firstly, this is a public 3-year plan that covers all programs and funding sources within a county's behavioral health division. So like I was saying earlier, MHSA and that reporting was only concerned with programs that were funded by MHSA. But now under BHSA, Lake County Behavioral Health will be reporting for all services within their behavioral health division. Also, the integrated plan outlines how BHSA and other behavioral health funding will be used to address local needs. So not just reporting on BHSA, but also all other funding sources that are supporting behavioral health services. The integrated plan also supports counties to meet new requirements when it comes to the housing interventions, full service partnerships, and early intervention programs. And it also supports and contributes to county level and statewide efforts to improve behavioral health outcomes and measures. And lastly, this is a very big change too. especially on the internal side, is that there is a preset template to standardize reporting across counties. So if you remember, or if you've seen our annual updates and 3-year plans in the past, we got to create the template. We got to create what it looked like, the format, but now this is much more standardized and all counties need to use the same template when reporting for their integrated plan. All right, behavioral health goals. So in addition to the funding and reporting changes, there are now these behavioral health goals. This is very, very new. So the Department of Healthcare Services, or DHCS, identified 14 statewide behavioral health goals focused on improving well-being and decreasing adverse outcomes, as you can see by the arrows on the screen. So the purpose of these goals is to inform state and county planning and prioritize resources. DHCS, or the Department of Healthcare Services, will continuously assess statewide and county progress towards these goals over time. And out of these 14 goals, there are 6 goals bolded, the ones that are bolded, that counties are required to address and report on. In addition, counties must choose one additional goal from the list. So future community meetings, just like this one, and other planning efforts will revolve around these goals, but that's not the focus of today. We just wanted to let everyone know that these goals exist and that we will be talking about them very soon.
And seeking community feedback.
Absolutely. All right, to round out this section, we're going to talk about the community planning process and what we have coming up over the next few months, because as Scott just said, we want to get all of your input on the behavioral health goals, as well as other elements of the integrated plan that will be submitted to the state. So speaking of community planning efforts, the community planning process is really, where we are coming to you all as the community, who are the subject matter experts of your local behavioral health needs, your strengths, and your gaps. So the BHSA intends that there be meaningful community planning, a meaningful community planning process to provide subject matter expertise to the development of integrated plans focused on utilizing the BHSA funds at the local level. So again, that's why we're doing this. We're coming to you all who know the behavioral health needs at a local level and can help Lake County Behavioral Health really narrow in their integrated plan to address the most pressing needs. So we really hope that all community members of different backgrounds, experiences, and perspectives join our community planning efforts. And under BHSA, counties must ensure that they engage these groups. So yeah, under MHSA, there was a list of stakeholder groups or groups that were required to be engaged with in this process, and that list has since expanded almost double or triple. So some of the folks that we're really hoping to have in these conversations include participants in behavioral health services and their family members. We really hope to talk to behavioral health providers and staff members, as well as medical or healthcare service providers and staff, education partners, public safety partners, social services partners. And now that we're moving into housing and the housing intervention component, we'd love to also include housing and homeless services providers, staff, and organizations. Of course, we would love to also include veteran services providers and organizations, local government and tribal representation, and labor representative organizations and unions. And this is not an exhaustive list. We really hope to have community members of all backgrounds joining our meetings.
And I just want to add real quick, if anyone here knows of some people that would be, maybe it's on this list right here or elsewise that you believe should be here, please let either myself or Patty know so that we can reach out and invite them.
I'll just
Absolutely.
also add one more plug, that one of the ways that we identify who we have from these different organizations is through that demographic survey. The very first question, if that's literally all you want to answer, it literally just asks kind of like what your affiliation is, and it helps us kind of understand who's participating and who we're potentially missing. So that's also why that's a useful thing for us that we plug over and over.
Absolutely. Thank you, Scott and Jamie. All right, so on a similar vein, everyone that I just named, including ourselves, Lake County Behavioral Health and others, everyone has a role to play in the community planning process. And here's kind of a snapshot of everyone's roles and responsibilities. So community members, we really hope that you all engage in this. We want to hear your individual perspectives and your lived experiences and your reflections. When it comes to behavioral health services, needs, and gaps, the Behavioral Health Services Department, their role is to develop the integrated plan and make sure that it's reflective of community needs, priorities, and identified strategies. The Behavioral Health Advisory Board is responsible for assuring that there was community involvement in this process. And they're also tasked with reviewing and advising on the integrated plan. And they are also the entity that hosts the public hearing. The Board of Supervisors will review and approve the final BHSA integrated plan. In RDA Consulting, ourselves, we are here to really support this process. We want to help collect and present findings on the current system and also offer recommendations for the future. We're here to facilitate discussions and compile information for the integrated plan. So we're really here to partner with Lake County Behavioral Health in facilitating this community process. All right, this is one of my last slides. So here are all of the community planning activities that we have coming up over the next few months. So bring out your calendar. So where we've been in the past, we actually used the summer and early fall to really plan these efforts. We have met probably weekly with Lake County Behavioral Health in planning this community meeting and ones to follow, as well as the ones that we have over the next few months. And then now we're really in that stage of talking with the community, inviting them to spaces and hearing from them. So we're hosting 2 community meetings by the end of this year. We're going to launch a community survey in the next few weeks. We're going to facilitate focus groups and interviews with certain groups over the next couple of months. And then from all those conversations, we're going to identify themes and needs from your input. Going into next year, which that should say 26, not 25, that's where we're really going to get into developing the plan. So we're going to have a 3rd community meeting, probably at the end of January or early February. We're going to share what we heard from the community survey, from the focus groups, and from all of our conversations with the community. After the 3rd community meeting, we're going to draft the integrated plan. And a key difference from MHSA is that Lake County Behavioral Health has to submit a draft integrated plan to the state by March 31st, 2026. So under MHSA, it was not required to submit a draft, but under BHSA it is. So as Scott was saying, that's why we're starting this community planning process much earlier than we usually do. And then moving into the spring, that's when we're going to have our public comment period and public hearing. Based on the feedback we get from the state, as well as feedback that we get from the community, we're going to update the plan. Lake County Behavioral Health is going to present the finalized plan to the Board of Supervisors, and then it will be submitted by June 30th, 2026. And Lake County Behavioral Health will also launch a request for proposal or RFP process for contracted behavioral health services going forward. All right, so to learn more about BHSA, please visit Lake County's BHSA webpage. That's going to be dropped in the chat. There's a lot of great resources on there. And in addition, we also have resources in this slide deck. So when this is posted and shared out, we highly encourage folks to peruse these resources if you have any questions and learn more about BHSA.
And we have a comment in the chat that the plan development should be 2026. And yeah, that was just an oversight in the timeline. So we'll be kind of spending the rest of this year doing, like what Paulina said, the stakeholder engagement and kind of soliciting feedback and talking to all of you. And then in 2026, those first few months is when we'll be actually kind of compiling the plan. So apologies for the wrong dates. We'll fix that for the next meeting.
Absolutely. Yes, it should have said 2026. So plan development will be after the new year. All right, so we're going to move into a Q&A portion, but first, we're going to do one more poll. So let me get that started. All right, so Jamie's going to put into the chat a link to the poll. We just want to know how you feel. Based on this statement, I have a good understanding of the BHSA and community planning process. Do you feel that that resonates with how you feel? Do you agree? Do you disagree? There's no wrong answers, and this poll is completely anonymous. Also, feel free to scan the QR code if that's easier for you in person and you have a mobile device. So thank you, thank you, thank you. So I think we have a mix. That is totally okay. This is so much information, and a lot of it is new. Looks like we have about 15 people participating. I'll leave it up for maybe another 20 seconds. Okay. Well, thank you all for participating. It's good for us to just get a sense of how folks are feeling. I know this is a lot of information. All right, and for the folks that are feeling, I don't have a great understanding, I'm neutral, or I really don't have a good understanding, we are going to have a time for Q&A. So please feel free to raise your hand or enter into the chat any questions that you have related to BHSA or the community planning process. I also see Allison's question in the chat. What is the due date for the integrated plan? So Patty added there that the draft is due by March 31st, 2026, and the final integrated plan is due by June 30th, 2026. Oh, I'm so sorry, Carrie. Oh, goodness. We can leave up the poll. So we have a question from Allison in the chat. You said that Board of Supervisors must approve. Is that before we send the draft? No. And also I invite Jamie or Scott or others. Board of Supervisor approval is only before the final plan is submitted.
Correct.
Yes.
Which would be after the public hearing.
Correct. Are we including them in the process now? So Board of Supervisor approval has always been a requirement under MHSA as well. But Scott, do you have anything else to add to that question?
Not really. It always, the Board of Supervisors always have been having the final say of our plan before we submit it to the state.
Great questions, though. Anyone else have any questions? Feel free to raise your hand. If you're in person, feel free to raise your hand as well.
We have a question here at the circle. Yeah,
Awesome.
Denise Ready Outreach and Prevention.
I noticed that you were talking about doing like focal groups, focus groups, that you were going to do some focus groups. And I just wanted to put 2 cents in. I really believe that we have a high level of older adult population. And I really believe that they deserve a voice. It doesn't seem like they get included a lot. And I mean, we have so many that really do have great opinions and great history and, you know, great experience in this world as we know it. So that would just be my 2 cents.
Amen to that. Yeah,
Absolutely.
yes, as 2 senior peers here, we totally support that also, that they're not getting enough attention. Their population.
Yeah, 1/3 of the population.
Absolutely. Thank you so much. Yeah, I think that there is an opportunity to have a concerted effort of getting those voices of the older adult community in those focus groups. Scott, do you have anything to add to that?
It's our intention just to try and reach out to as many different folks as possible, so we can get you know, a pretty fair and balanced and accurate representation of what the community is feeling.
Absolutely. And we're taking notes, so we will keep, if you have any ideas or suggestions and not questions, that's also welcome too. So thank you so much for sharing. Anyone else? I'll move us over to this slide. Yeah, any questions or suggestions? Right. I'm okay with silence.
No, we can go on too.
We can move forward, yeah. If anyone has any questions that they don't want to share out loud or in the chat, as always, please feel free to email Scott Abbott. He can put his email in the chat and he can follow up with you separately. All right. Would we like to move forward or take a break, or how are folks feeling?
I said,
Maybe. Oh, go ahead.
It's 10:55, that's what it says right here. Can we just go ahead and take a break now?
Yeah,
Couple
let's take a
minutes.
break. Let's take a couple minutes. Feel free to stretch, grab some water, and then we'll head into the second part of our meeting. So let's meet back at 10:54. That'll give us 5 minutes. Don't go anywhere. See you all soon. All right, we're going to come back together in the next 30 seconds or minute or so. So find your way back to your chair or your desktop, wherever you're at. Hopefully folks were able to stretch. I stretched.
I'm not sure if everyone is back yet, but I did drop a link. I was retrieving the link when you announced the break. So I dropped a link in the chat for the invitation list registration form, which I created to allow anyone who might not already be receiving invitations, who would like to, they can fill out this form and I will add them to the invite list immediately. The link can also be shared, so put it on whatever platform you like to use, and it's the more the merrier, and everyone's welcome to be on this list. So
Thank you so much, Patty. I love that. I love that it's shareable.
it's also found at the very bottom of our department website, the first page of the Behavioral Health Services website. If you scroll all the way to the bottom underneath all the newsletters, there is a link to that form, and there's also an embedded version of the form. So I'm like really pushing it. Fill out the form, get on the list.
Love it. Thank you. Thank you. All right, I see more people on camera, so I think we'll get started here, and I'm going to pass it over to Jamie to lead our next section.
Thanks, Paulina. So this next section, we're going to share some more information for another like maybe 20 to 30 minutes. We know this is a really information heavy meeting, more so than compared to some of the other ones maybe, but just trying to kind of set that foundation. And we will have some time for discussion and feedback at the end of this. But this next section, so Paulina kind of talked about some of the funding shifts. We want to talk about that in a little bit more depth and detail, and also a little bit more of like what that might mean for Lake County. As we go into this next section, I just really want to reiterate that all of this is still very much being determined, this kind of puzzle of how funding will transition from MHSA to BHSA. And a lot of that, we want the community's feedback to help us understand that. We're also still getting guidance from the state about what that could look like. For Lake County as a small county, small counties are eligible for some different exemptions, which we're still learning. So just kind of want to put that caveat as we move into this kind of next section. We can move on to the next slide. So some of you may have seen this graphic before. So this is an overview of kind of how the funding is shifting from the MHSA categories into these new BHSA categories. We're going to talk in a little bit more detail in a few minutes about some of the nuances of this and more what that might look like for Lake County. But this is more of just kind of a general overview. So the top row of this graphic is the MHSA allocation as it's been and as it is this year. And the bottom row is the BHSA allocation and how this is going to shift starting July 1, 2026. So there's a lot going on, but kind of some of the key takeaways are that right now under MHSA, with that 1% tax on millionaires, it's still going to be a 1% tax on millionaires. So the whole pot of money is going to be the same. But what's changing is that with MHSA, the states right now get 5% of the total pot and counties get 95%. One change is that the state is going to get a little bit more. They're going to get 10% of that total pot and counties are going to get a little bit less. With that additional money that's going to the state, they're taking over some of the things like the statewide prevention programs and also a little bit more with the workforce education and training that Paulina mentioned. In this top row of the graph, so there are 5 funding categories within MHSA, but there's 3 kind of main ones. The workforce education and training and the capital facilities are kind of optional. But so the main ones are, as Paulina mentioned, the community services and supports. This is the bulk of how counties use their MHSA funding, 76%. About half of that goes to full service partnership programs. And the other half of that is used for other community services and supports. So if you remember that slide that Paulina showed earlier, this is things like outreach and engagement, crisis access continuum, peer counseling, parent partner support, things like that. The next bucket is prevention and early intervention. About 20% goes to that. Half needs to go to children and youth under the age of 25. The other half goes to other prevention and early intervention initiatives. And then 5% goes to these innovation funds. And again, like the workforce education and training and the capital facilities is optional. Lake County has funded those. But the way that these translate are, so in the community services and supports, as I said, about 39% goes to full service partnership. More or less, that's going to be maintained. So under BHSA, 35% now needs to go to FSP, but about 39% was going already. One of the biggest changes is now all of these other community services and supports, the prevention and early intervention, innovation, and if a county chooses to spend any money on workforce education and training or capital facilities, all of that is now going into this behavioral health services and supports bucket. So about a third of BHSA funding is going into this. Again, about half of this behavioral health services and supports bucket needs to go to early intervention projects. Half of that needs to go to children and youth under the age of 25. And then the remainder of this can go to any of the other programs and services that would fall under behavioral health services and supports. The other big change is now that there's this housing component. This is a new funding category that, and again, about half of the housing component needs to go to folks who are experiencing chronic homelessness, and then the other half can go to any other kind of housing initiatives. We'll get into a little bit more about kind of what that means, because what's going into housing is actually some things that have been funded under MHSA, but we'll talk about that in a second. We can go to the next. Scott, do you have anything to add, or we can go to the next slide?
I just wanted to address Rebecca's question there about, so there'll be less services, and I think she put that in there when you mentioned that the state would be taking an extra 5%. I think a good way to answer that is just kind of remember where this funding comes from. It comes from 1% of millionaires, so it's based on tax revenue, and as the case, and then as tax collection goes, that means that funding stream is a little volatile. It's not always steady. It depends on the tax revenues that are collected for any given year. Sometimes they're delayed because of when we had wildfires and other disasters that have happened. The state has allowed delayment in payment, and millionaires, their income varies sometimes, and so the tax revenue also varies. And so what comes to Lake County, we get a very, as you can imagine, a small percentage of what the state of California collects. And I'm just looking right here in 23-24, we had about $6.7 million that came in. The same thing came in 24-25. This year there's a dip, 25-26, where we're getting estimated to be $4.9 million. And then it's projected to go up again a little bit next year, up to $5.6 million. So, it does vary. And because it varies like that, we're always kind of conservative about our spending. And so because anything that you don't spend carries over into the next year. And so the idea is that because of that, we have 5 years also to spend any particular year that we receive. And so, because of those two factors, we can kind of be judicious with how our spending goes, and so we can kind of remain about as level as we can, recognizing there'll be dips, ups and downs, but if we kind of keep in that middle ground, we're hoping that we'll be okay. And that includes, so when they take an extra 5%, that's not going to really make a huge difference because of the ups and downs that we go through. It's a long answer to a short question.
Well, thank you for explaining that.
Yeah, really helpful context. Thank you. And thank you for the question as well. Okay, so we can go to the next slide. So we just wanted to provide a little bit of an overview of like what is going into this housing intervention bucket, because this will provide some context for some of the future slides. So again, about a third of the BHSA funding now needs to go to this housing intervention category, half of which needs to go towards folks who are experiencing chronic homelessness. Counties can also decide to use up to 25% of this bucket for capital development projects, so like building or buying or renovating. But other types of interventions that would be covered under this are things like rental assistance, operating subsidies, placement and permanent and interim housing, kind of other housing supports like landlord outreach and mitigation, assistance funds, navigation services, outreach and engagement. So actually 7% of this housing intervention bucket can be used for housing related outreach and engagement. So outreach and engagement to get people into housing, and some other different types of things. One of the key points here is that housing for FSP clients also needs to go under housing intervention. And this is a change, and we'll show the numbers in a little bit. But so previously under MHSA, you saw that bucket where about 39% of funding had to go towards FSP. That included FSP services as well as housing for FSP clients. So moving into BHSA, those funding streams are actually going to be separated. So only FSP services will be funded under kind of this FSP component, and the housing for FSP clients will move into housing intervention. And that's actually a significant amount of money, and it's a significant amount of what was paying, it's a significant amount of kind of what was being paid for under FSP. So that's a big change that we also wanted to mention.
And that's something that we realized recently, I mean, within the last few months, discovered that we cannot use any FSP funding for housing. We, of course, have used in our plans a good portion of our FSP funds for housing. And so what Proposition 1 BHSA is saying is now any housing that we spend has to come out of that housing category, not FSP any longer.
Yeah. So moving on to the next slide. So for folks who have participated in some of these meetings, like Scott mentioned, this is kind of a relatively recent understanding that we've had. So small counties are eligible for a number of exemptions. One of the biggest ones is for housing. And we spent a lot of time last year kind of getting some community input about housing exemption for Lake County. So small counties for MHSA, that means counties with a population of less than 200,000 that meet specific criteria, based on the level of housing need or the amount of funding that's already going to address housing, as well as some other considerations. Small counties could request exemptions from the housing component. This means that they could request to allocate less than 30% to housing interventions, no money to housing interventions. They could request an exemption from allocating 50% of the housing intervention to the chronically homeless, or even an exemption for maybe allocating more than 25% to capital development. Again, the capital development is totally optional. This is not something the counties have to do. But so last year, as we were sharing about BHSA, we were getting some input about whether or not the county should go for this housing exemption. But like Scott mentioned, this was before we understood that FSP housing had to be under housing interventions. So after reviewing the amount spent there are actually a number of housing interventions that are currently being funded under MHSA. They're just kind of hidden in these other categories. Like Scott mentioned, like an FSP, We'll go over this, Scott will go over this in more detail in a couple of slides, but also in other community services and supports, there's some housing embedded in there. So all of that needs to move into housing intervention. Once we realized that, I think the county determined that we actually won't need to go for this exemption because most of that money will actually equate to close to 30%. So just wanted to kind of provide some context for folks who have been here, who've maybe heard about this housing exemption. We're realizing that with the way that the money is going to shake out, that the county probably will not need to go for this housing exemption because once the money is moved into housing intervention as it's required, it will get close to this 30% threshold. Scott, anything else to add there before I kick it over to Melissa to talk about some of the housing availability?
You know, I think you summarized it pretty good. I imagine there's probably a lot of questions that people have, because this was kind of a big revelation for us when we came to this, you know, recognizing that kind of what we've been doing already with housing will just be able to fit into that housing category. So it's you know, but previously I was very concerned that, you know, this housing category was going to take away from services. Now that we have, you know, but we're already been doing housing as it is. And so what we'll, you know, so essentially what we'll be doing is
I think Scott might have
Yeah, I think
frozen.
he might have frozen. Yeah. We will actually, so, and Allison, I see your question of what is the impact for this FSP revelation on BHSA housing. So if you can hold that question for like 5 minutes, we are going to actually talk through kind of ways that the county is exploring kind of how the funding could be shifted and how it's going to fit into these different buckets and different puzzles. So in the next slide, we just want to provide some context as well of just kind of what does homelessness look like in Lake County? What is the scope of the need? What's kind of already being done, both within funded by MHSA as well as kind of housing that is funded outside of MHSA and outside of LCBHS, because there is a lot going on. So I'm going to kick the next slide over to Melissa to kind of talk through that, and then to Scott to talk through specifically what housing is being funded by MHSA right now.
Hey everyone. So here's a quick snapshot of what homelessness looks like in Lake County. In any given year, we have roughly about 412 people experiencing homelessness. And that's kind of an approximate amount for pretty much like one night out of the year for these individuals. And when we look at the data, we see that there's like an age breakdown of some of these individuals. And so there's a breakdown on the slides there. You can see that the adults 26 and over or older end up representing about 257 of these individuals. We've got Tay age 25 to 8 or 18 to 25 that represent about 65 individuals who are experiencing homelessness. And then 90 and younger roughly represent the youth in Lake County. And so one of the data points that we ended up collecting this information from is the Continuum of Care's annual point in time count and housing inventory count, along with the homeless management information system data. So when we start discussing the housing inventory in Lake County that are addressing and housing some of these individuals experiencing homelessness, over on the right-hand side, you can see the inventories for the emergency sheltering. We've got transitional housing, other permanent housing, permanent supportive housing, and then rapid rehousing. And then the beds that are associated with these programs. So in Lake County, we're looking at roughly, about 55 individuals who are in emergency sheltering beds at any given time. And some of those 55 individuals are our FSP clients with behavioral health. And then with transitional housing, you see that we have 74. Other permanent housing, that number comes from the Department of Social Services, and those would be our HUD vouchers, Section 8, BASH, emergency housing vouchers, things along those lines. So that ends up making up that 512. When we look at the 55 in permanent housing, the permanent supportive housing, those are all FSP clients and clients of behavioral health services. And then for rapid rehousing, the majority of those end up being households with minor children. So that's kind of a quick snapshot and breakdown of the data within the Lake County for homelessness. And I'm not sure if Scott ended up coming back on, if he has anything he wants to add. Okay.
No, I think that's a good summary. One thing I just want to add, or to emphasize, is Lake County Behavioral Health Services has always been very concerned about housing, recognizing that there was a natural overlap between folks that are homeless and folks with behavioral health issues. It's not a 100% Venn diagram match, but there is a lot of overlap. And so we've always been very concerned about that. And it's one of the reasons, or the main reason, that we are the administrative entity for the Lake County continuum of care on homelessness. So we're always trying to be very cognizant of addressing homeless issues in our community.
Thanks, Scott. I think, Paulina, we can go to the next slide. And Scott, this will still be you.
Okay. This is a little bit of a summary right here on the left-hand side of what we were talking about before, that the funding is, this is the funding that we have spent in 24-25 on housing. The first two were the FSP housing and housing operations, which included motel stays, paying for motel stays and rental assistance, totaled at $931,000. And then also FSP board and cares is for folks that are in our local board and cares. We have a couple here in Lake County for folks that are being worked with in the FSP treatment program. And so those are the first two, or the top ones are for within the FSP program. The other two, also MHSA, weren't in FSP, but were housing related. One was in the general systems development, and it was more for crisis housing for people that have gone into motels in a crisis, and also for a housing coordinator, which wasn't before put under FSP. So if we combine these together, you can see we have the $1.3 million, which is pretty close to that 30% of housing. Particularly like if we add something in there like the nest, which also wasn't FSP, but was housing related. And so that's where we kind of feel that we come pretty close, as you can see on the right-hand side right there, to that 30%. The difference, you can see a little bit of difference right there. And so we do want to allow some flexibility in what they call being able to transfer 7% into a different category. And so, from that we can, for example, we can do housing, actually housing outreach would be part of this, and so that's something we can add to this. But other types of outreach, which would be, we're thinking like 7%, can also, account for this. And so between all that together, we're really right there at that 30% housing. That makes sense.
And there is a question in the chat from Kim. And I do think we might answer this in the next couple of slides, but if we don't, Kim, let us know, but I'll just read it out loud so everybody else can see it as well. In previous planning meetings, Elise spoke to there being an excess of unspent housing dollars. This led many stakeholders to be under the impression that if the county applied for the exemption, that there would be less impacted programs funded through MHSA and BHSA, particularly peer support centers. Can you clarify what, if any, impact this decision would have on the peer support centers? So I think this next slide, or Scott, Paulina, can you
That's a great question.
Yeah.
That's a great question then. Okay. This is a magical slide that I'm going to let you address because you're the artist.
Yeah, I can walk through it and then Scott definitely jump in specifically to like Kim's question. So
Yeah,
again,
I want to address, if you can cover the slide, I'll address Kim's question.
Perfect. Okay. So I know that there's a lot also going on in this graphic. So this is kind of a reimagining of that first graphic we showed a little bit ago. So this is more of kind of how the county is exploring how funding could potentially shift into these different BHSA categories. So this is still very much kind of in the air and trying to figure out how this puzzle fits together. But on the left-hand side, in this gray box, we have program types that are currently being funded under MHSA Community Services and Supports. On the right-hand side, we have, in this gray box, we have programs that are currently being funded under MHSA Prevention and Early Intervention. And they're kind of color-coded of where we think they might fit within these new BHSA categories, which are in the middle. So FSP, as we mentioned, under CSS, FSP services and housing were funded together. Now those need to be split out. So FSP services will go into the full service partnership, whereas the housing will go into the housing intervention. So that's going to leave some extra money within FSP that the county is kind of exploring how, so if there's other services, getting creative and thinking of if there are other services that could potentially be funded under full service partnership. So one thing that we haven't talked a lot about is that the county or the state, as part of BHSA, is also asking full service partnerships to implement various evidence-based practices that will kind of standardize services across the state. Some of those things include things like employment support, implementing something called the assertive community treatment model that includes things like peer support, housing support, benefit support, all of those different types of supportive services, some of which the peer support centers are providing, not just to FSP clients, but more broadly. So one of the things that is potentially being looked at is like, can any of these services actually now be funded under FSP? And what would it take for that to happen? So that's kind of one place of kind of creative thinking. Other things that Scott just mentioned that would go into housing interventions are, you know, some of those, the general system development housing, the MHSA coordinator position, things like street outreach or things that are housing related outreach. Also exploring if there's other programs like the Nest he mentioned that's currently funded under PEI, but seeing if that could move into housing intervention. And then also seeing, as we mentioned, up to 7% of the housing services can kind of be used for outreach and engagement. Then kind of the remaining services that don't fit into FSP and don't fit into housing would be funded under this behavioral health services and supports bucket. So other more generalized outreach that's not housing related, that's more to engage people into behavioral health services. Some of the other services that are currently being funded under community services and supports, other services provided by this peer support centers that like aren't specific to FSP clients or don't quite fit that model, as well as the other prevention and early intervention services. Another important point that Scott mentioned is that 7% can also be moved from one funding category to another. So for example, 7% of full service partnership money could be moved into other behavioral health services and supports. 7% of housing intervention could be moved into other behavioral health services and supports. So up to 14% total can be moved into different categories, but only 7% from each component. So there is some flexibility of kind of how these funds can be moved around. And that's something that the county is very much still exploring and trying to figure out. And Scott, I'll pass it over to you to add anything else.
That's a pretty good summary right there. To specifically answer, Kim, your question right there, as you can see on the right-hand column, peer support centers. We're really envisioning that this was kind of a revelation as well, that we can use FSP dollars for peer support centers, with the idea that they are serving FSP clients. And that happens regularly as it is. We just haven't counted it as FSP before. But they are serving FSP clients. Therefore, we can use FSP funds to help fund the peer support centers. FSP is also having more requirements with evidence-based practices. And some of those evidence-based practices require peer support. And so it's a natural fit, to have peer support being part of FSP services, much more than it was before. To me, this is not only something that's very new, but also helped me relax a little bit. So I was very concerned about housing, this new housing component taking over MHSA, and where we had to redo services, but recognizing that we can kind of reorder services, as this graphic illustrates. We can hopefully keep things functioning going forward as they have been. I think we can do some, we'll have to do probably some improvement, being tied to peer support centers into FSP. Probably looking for more ways that we can leverage FSP funds for Medi-Cal to also support the peer support centers. And so there's I think there's some things that we can do. We can take advantage of this change to strengthen the programs and provide better services for our community. So I don't think it's doom and gloom like I was originally thinking.
And Kim had a follow-up question in the chat of what percentage of the other behavioral health services and supports would need to be allocated to peer support centers to maintain operation?
Percentage of other behavioral health services. I'm not sure if I understand your question there, Kim. Could you maybe describe that a little bit?
Hi, can you hear me?
Yes.
Okay. I'm not sure exactly if I worded that well, so appreciate your patience with me. I think I'm just wondering, I was looking back at our other slides of what funding had been previously allocated, or what funding stream had been used to fund our peer support centers. And yes, I realize we would need to leverage FSP dollars to help maintain operation of those centers, but I'm just thinking of 35% of those other behavioral health services and supports. Of that 35%, how much of those dollars would be allocated to the peer support centers? And you may not have an answer for it, and I still may not be communicating that very well, but if you could break it down at all, that'd be awesome.
I don't have a great answer for that.
Okay.
Because that other category, that third category, also includes other things, including things such as our PEI. Currently, it's the PEI mini grants that we do. We have some contracts that we use for other PEI things, such as with Motherwise and Connect Senior Support. And so there's some other, we have some other categories or other programs that we'd like to keep on, keep operating and fit it into this as well. But like I mentioned, I think even if we keep, all the same programs, I think we can also leverage more Medi-Cal funding to support those programs too, which is something I would really like to explore further, to help our programs out.
Hi.
Hi, we have a question.
This is Janet. I'm not sure how to exactly say it, but I do come across people struggling to try to get the state of California peer certification certified. So wouldn't it make sense that you would be struggling or whatever, trying to get your people who are peer counselors more trained, so then you can do more Medi-Cal billing, which would help financially? Can you address that?
I'm sorry, were you talking about peer certification?
Yes.
Oh, great. Yes, that is something, that's a great question. It's a great insight, because I've thought the same. Not that I'm great at insight, but I did think of the same. And I think that, if peer support certification is very, very important. We've addressed it with our internal staff, and I also think we can help support the external staff, our contractors, to be able to have that same ability as well. Peer support, you have to be certified in peer support to bill Medi-Cal. There's also some other requirements for Medi-Cal that require clinical supervision of those peer supports. So we'll have to figure that part out as well, so that our programs, both internal and external, can bill Medi-Cal for peer support.
I have a question. So the peer support certification, and you said that they need certification or supervision after that.
Mm-hmm.
So what qualifies you? Does a master's in counseling psychology qualify you to be a supervisor?
Right. If you're clinically licensed.
I'm no longer licensed, but I do have a master's in counseling.
Okay.
Psychology. I know that I could do I had a couple of situations where I actually did supervision for some bachelor students. So I didn't know if that was something that, do you have to be a licensed clinical? Do I still have to be licensed to do that, is what I'm asking?
You have to be licensed or waivered.
Okay.
And waivered is that you are, and if you're not familiar, waivered is that you are working toward licensure.
Okay.
You have the education and you're working on your hours.
Okay, thank you.
Any other questions about this? I really appreciate this graphic that Jamie's designed right here. I think this is a good graphic to come back to when with questions that you have about the shift in funding, because columns on the right and columns on the left are the current MHSA major components. There's also the component of innovation, which is in MHSA was 5%, but that is now going away. And so that 5% is, we're not required to spend 5% on innovation any longer. And so, which I guess probably coincidentally, the state is taking 5% more as well. So maybe that balances it out. But these are our two main categories in the past. The one on the left has been roughly 74%, and the one on the right has been 19% of allocated funding. And so this is a great snapshot of where the same amount of dollars will go for new 3 categories for BHSA.
And we have one more slide that's information. And then the rest of it will just be kind of like discussion if you have other questions. So this is really more of a recap if you're more of a verbal words person than a visual person. So some of the kind of funding shifts that are being explored to kind of make the funding from MHSA to BHSA work are considering allocating some funds in the housing intervention to housing focused outreach and engagement. Similarly, potentially transferring up to 7% from housing interventions or something else to behavioral health services and supports. Looking at funding the NEST through housing interventions, looking at how services provided by the peer support centers can be funded under FSP. And then, like what Scott was just talking about, seeing how to better leverage Medi-Cal billable services to have more services that can be funded under Medi-Cal, which would then mean that we can kind of preserve BHSA dollars for the non-billable services. So that's kind of just a quick recap. And then I think we're now moving into questions and then another poll and discussion.
Yes, thank you, Jamie. Thank you, Scott. Also, thank you, Melissa, for the housing data. Are there any questions related to what we just discussed? I'm going to just pause for a moment before we go into our discussion. Kim, I see your hand is up.
Anywhere?
You're good. Gotcha.
You're good. Okay. Can you see me?
Oh, hi. All right. Cynthia from the Nest has a question.
Hi, my name's Cynthia Barnes and I'm with the Nest. I'm the case care management at the Nest. I have a question. We have several clients who come in who are in our age range to be at the Nest and be accepted into our program, but they have aged out of the benefits, which doesn't allow us to have billable services for those clients who are in-house, who we provide those services for. And I was just wondering if maybe we could do something about that.
So much.
When you
Scott?
when you say age out of billing, what is that? What are you referring to?
RCS holds a specialty mental health contract for TAY youth up to 25 years old. And so if they enter into the Nest at 25, which would make them eligible, sometimes due to the length of time they can serve in the program, sometimes they will age out of being eligible for those billable services, which I think is kind of what you're saying, is that how do we leverage Medi-Cal services to fund our programs? But there's that potential that when they come into the program eligible, they will essentially meet or exceed that age range for us to provide that. So I think we were just, Cynthia was asking if there was a way to continue to leverage those funds for clients who are already enrolled in our programs who may have then aged out of our specialty mental health contract.
Yes.
Is that?
Yes.
Okay. Yes. Without sounding insulting, I think that's a no-brainer. We want continuity of care, and it should be that way already for you folks. Just because someone ages out doesn't mean that they're ineligible for services. If they started there under 25, they should be able to continue.
We would love to continue this conversation probably offline from this meeting to see how we can make that happen. Thank you, Scott.
Thank you, Scott.
Thank you so much. All right. I'm going to move us forward into our next section, but there will be plenty of opportunity in the next 20 minutes to share additional thoughts, questions, suggestions. So we want to hear from you. So before we go into our discussion, we would love to do a brief poll. We would love to know, what is your initial impression of these proposed funding shifts? This is the first time that many folks are really hearing of these updates. We would love to just get a pulse check. Are you feeling positive, optimistic? Are you feeling negative or concerned? Or are you kind of in the middle? Maybe I need more information. I'm not really sure. So please feel free to join our Mentimeter poll. We have the link in the chat, or if you would prefer, you can use your phone or mobile device to scan the QR code. And this is completely anonymous as well. Right, seeing folks answering, and it looks like we have a range of feelings, which is so understandable. This was a lot of information and a lot of new updates. All right, we have 13 responses. Again, feel free to navigate to the link in the chat if you're online or scan the QR code. All right, I'll leave it up for maybe another 30 seconds. It looks like we have a majority of folks who are feeling unsure and need more information. And the great thing is that we have 2 more community meetings after this. So many opportunities to continue absorbing this information, ask questions, and kind of we can work through this together. Like Jamie and Scott were saying, a lot of this is still being worked on. This is a puzzle that is being put together. And so things will change over time. All right, it looks like the poll is kind of slowing down. Oh, go ahead, Scott.
I think, you know, we have some discussion questions coming up here. I'd like to add a discussion question that's, you know, very germane to what we're seeing right here, and is what can we do, what can behavioral health do, the RDA do, to help folks understand this new transition process? What are some ways that we can help you understand, and or if you have concerns, talk about those concerns. What can we do to address those?
Absolutely, that is such a great question, and yeah, we would love to hear from you all. If you're feeling unsure, is there additional information we can share? I see Allison in the chat. I think that it is unclear what the effects will be for funding for programs. Are they gaining funding or losing funding with this new recategorization? I think I'll go through all the questions because I think there might be a theme. Kim put, the information about future plans is ambiguous and sparks fears and uncertainty for the future of programs in Lake County. Harry suggested, I feel that having informational sessions in person. Yes, absolutely. All right, so based on those 3, I think there is a theme. The future being ambiguous, maybe some clarity is needed around where funding will go for programs. And I would love, Scott, for you to chime in as well, but I know that that's something that will be cleared up over time, but something that may not be known right now.
I think what the goal is, as I kind of mentioned a little bit earlier, well, you know, starting with the amount of funding will remain approximately the same, 1% of the millionaires. So we're getting the same amount of funding. You know, they required that 30% for housing, but we're already doing about 30% overall for housing. And so it's really just more of a reshuffling of the funding behind the scenes so that programs will be able to continue outwardly to those that are receiving them.
Thank you, Scott. Looks like we have a hand raised, Kayla.
This is Kim again. We're just having technology issues, so it's just easier for me to come up here. I'm going to put this in our feedback survey, but I also would like to mention that the times that these planning meetings are happening, 10 a.m. to 12 p.m., I mean, explicitly discriminates against our youth who do not have an opportunity to have a voice or a comment about the changes to these programs that they are utilizing every day. And so I don't know if we can consider in the future adjusting the time of these meetings, but they're excluded from participating, and I think we're missing their voice. And so I would just like to propose that as an option for future meetings.
One of the things that we want to do, Kim, is we want to do more focused groups, particularly with the peer support centers. And so we could work that to a time that's better for the population you serve.
Absolutely. Thank you, Kim. We have that as a suggestion. And like Scott said, we're definitely going to be hopefully having a focus group that targets youth specifically. All right, so I'm going to move on to our discussion questions. I do want to lift up Jermaine's comment in the chat. This is a lot of information to take in right now, but after taking time to go over the information, it should be clearer. Thank you. I think that's probably the case for many folks here today. All right, so we have about 12 minutes or so, and these are some big questions, but we'd love to hear from you. We're going to stay as a big group. We're not going to go into breakout rooms, but we'd love to hear from you all. What should Lake County Behavioral Health Services consider as they create the new BHSA funding plan to best meet community needs? So for example, which behavioral health services matter most to you, your family and your community? Are there specific services you believe should be prioritized in future funding? And where do you see gaps in behavioral health services in your community? So I'm just going to leave that there. My colleague Julia just put them in the chat. Feel free to come off mute or put your answer in the chat.
Or if you have any other questions based on what we discussed today too.
We have Allison in the chat, older population of half or 1/3 of the county. So seeing that as a population that may be underserved at this time and there may be gaps. Allison, yeah, feel free. Oh, go ahead.
Sorry, I was just going to say that Becky just mentioned that our older population also can't make it to the meetings, whether it be transportation, physical wellness, and
Not having access to computers for Zoom.
yeah, they don't have computers, so they can't go on Teams or Zoom or,
No, thank you for that. I feel, Carrie, let's definitely work together on maybe what that solution would be, because we definitely want to have them involved in this process too.
Right.
Absolutely. All right, I see Kim's chat. So Harbor team would like to emphasize that peer support centers as being valuable resources for linkage and support to mental health and substance use services. The Nest is an essential program for young people who are often passed over when it comes to permanent housing opportunities due to their lack of rental history, long-term income, etc. Thank you so much. Appreciate flagging and calling out specific services and programs. Yeah, that's what we want to hear for sure. I'm hearing a lot of peer-based services is really where, like, that is what really matters in your community, and that's where that should be prioritized in this funding plan. That's what I'm hearing. Anyone else have any other specific services or maybe populations that are underserved? And as a reminder, behavioral health services, we are talking about mental health, substance use, and housing with BHSA. So feel free to expand behavioral health as well into those categories.
Right, that is very significant. We kind of, I'm not sure if we glossed over it or just the dollar part became the most interesting part, but this is an integrated plan. We have to have this plan will include, for the first time, our substance abuse services, or other services such as justice involved, other, program that behavioral health has outside of MHSA. And so it's our first really truly integrated plan.
Absolutely. Any other considerations? Lake County Behavioral Health will be building out that funding plan over the next few months and would love to have community input.
I kind of get the feeling that, especially with that last poll right there, that this might be, pretty overwhelming. A lot of new information, as Jermaine said there. I think, like I said, Patty's going to send out these slides this afternoon, and probably, maybe one of the first things to do is kind of review the slides and try and, absorb the information. And then if you have further questions, then please reach out to us. We're going to be, again, doing future meetings on this. But if you, want to get a better foundation, then please reach out. This a little bit of a warning. We don't have, a lot of 100% firm answers because we're still developing this with the community. And so we're getting this feedback. But we can at least kind of tell you what the regulations and confinements are of BHSA.
Absolutely.
And that those resources that are on the slides, the links are also good places to go and learn more as well.
Absolutely. I'll have one of my team members, if possible, drop Lake County's BHSA webpage as well into the chat. Looks like we have a couple other chats. So Rebecca says we need more food resources. Allison, it would help to see the success of the prior MHSA funding. Allison, to your question, our next community meeting, I believe it'll be the next one. We may be able to have a chance to hear from programs that are currently being funded. So stay tuned. And then Carrie has a chat as well. How can we provide more in-person trainings locally for peer support certification and more funding for the certification? Absolutely. Great plan, or a great suggestion for the plan, as Lake County will have to leverage Medi-Cal billing. Thank you. Perfect. Clarification that it was from a community member. All right. If there are no other comments, questions, or suggestions, we may move forward because, as Scott said, I know this is a lot of information. All right.
And all of these slides and links and resources are going to be along with the recording in the follow-up email that I'm going to send out before the end of the day today. And of course, take your time. And then the next meeting I think we have scheduled for December 11th. So there's going to be time to ask more questions if they come up. So I just wanted to put that out there. All of this stuff will be sent out to everybody who was invited to this meeting today.
Thank you so much, Patty. Awesome. All right, next steps. So we have a lot coming up, and so we want to make sure that this is on everyone's radar. So we will be releasing a community survey by mid-November. That will be another opportunity for everyone to provide input on strengths, gaps, and needs within the behavioral health system. And that will be open probably until mid to maybe end of December. We haven't totally decided yet. So definitely be on the lookout for a community survey in November. As discussed, we're going to be doing focus groups and key informant interviews also between November and December. We have a couple groups that we already know we're going to reach out to, but if you have additional groups that you think should be spoken to, please email Scott as well as our team as well. We would love to get as many ideas as possible. And as Patty said, our second community meeting is December 11th, 2025. I believe that's a Thursday. It is already scheduled, so unfortunately it will be from 10 to 12, but I do hear everyone's concerns around the time. And I think for our future meetings, we will try to find other solutions. Our third community meeting will be at the end of January, maybe the beginning of February. And then, as we talked about earlier, we will then dive into developing the integrated plan. So we have the draft plan due March 31st, and we have the final plan that will be submitted on June 30th. So we have a very busy next couple of months. All right, as we're closing out today, we would love to hear from you all. I heard from a couple folks that they were going to already fill out this survey. We'd love to hear from you on suggestions on how we can make this meeting better. So please click the link in the chat that Julia just dropped in there, or if you have a mobile device, feel free to scan the QR code. It'll take you to a very brief, I think it's 3-question survey, just on your experience during the meeting and any way that we can make it better. So I'll pause here for just a second before going to my last slide. And if you're in person, you should have paper feedback forms. All right, the link is still in the chat. And with that, thank you all for being here.
Paper feedback forms.
Sorry?
I did not get the feedback forms to print them out.
Oh, I'm so sorry. I thought I included
I
those.
sent them to you, Carrie.
Well, I got everything except for those. I don't think those were included. I'll go check real quick.
I'll go ahead and resend them to you, Carrie, right now, just in case. I have the feedback forms right here.
Perfect. Thank you so much, Patty. Yeah, apologies about that. This is also a survey that can be filled out after. So if you need to go and grab lunch, you could fill it out at your own time as well. All right. And with that, yeah, thank you so much for being here.
Yeah, and I just want to add my thank you just real quick before you sign off there, Pauline, is just again, super appreciate the community members being here to participate in this. Not only is it a requirement, but it's also greatly beneficial for us as a department, because we want to be able to serve the community and having the community help us formulate strategies and priorities and directions is just really needed and basic. And so your being here helping with that is so appreciated. And we hope to keep engaging you in this process.
Absolutely. The RDA consulting team also seconds that. Thank you all for being here, for taking 2 hours out of your day to be with us. And we look forward to our next meeting on December 11th.
And watch for the follow-up email from me and the invitation to the next meeting, because I'll be sending that out very soon.
As well as invitations for the focus groups.
Yes.
Thank you.
And I'm going to stop recording.
All
Right.
right.